It's a new day in modern dentistry. You can feel like yourself again with Shatkin mini dental implants. Mini dental implants are the safe, fast, and cost-effective solution to many dental issues. Do you suffer with loose dentures? Are you afraid to smile or unable to eat the foods you love because you have missing or broken teeth? Mini dental implants are your affordable solution.
I've had problems with my teeth.
I couldn't eat almost anything.
I had this big hole in my mouth.
I knew it was time to do something permanent.
I'm gonna go and get this done.
It's just unbelievable what it's done to my life.
I feel like me again.
It'll be the best, smartest move you ever made.
Kind of gave me my life back.
The mini implants are the only way to go.
Just real happy I did it.
I would recommend it to anyone.
Do it over in a heartbeat.
It's been great.
It's incredible. It is. It's absolutely incredible.
Hi, I'm Dr. Todd Shatkin, and welcome to our beautiful new Aesthetic Associates Center.
It is Innovations in Health, and I am John DeSchuler, your host, and I am welcoming back to the show Dr. Todd Shatkin from the Aesthetic Associates Center. Dr. Todd, welcome back.
It's always a pleasure to be here, John. Thank you very much.
You are welcome. Dr. Shatkin, the mini dental implant, your procedure has changed tens of thousands of lives. People can be them again. You can be you again. Mini dental implant is 5 times less. It's less invasive, less discomfort, less healing time, less visits to the dentist, and less expensive. We've heard from some of the people that have experienced this. Let's find out why. And this first model is probably the best example of a conventional implant versus a mini implant and the difference that it makes.
Well, you know, I've been talking about mini implants now for a long time here in Western New York, and I started doing these back in 1999, so we're talking about 20 years that we've been placing mini implants. And prior to that, I did the conventional implants, which is a much more involved procedure. And with the mini implant, the reason it's so simple is we only make a very small pilot hole in the gum and then into the bone without cutting the gum open, without doing any major surgery. You don't have to remove bone or do major bone grafting procedures that can take up to a year to complete. This model shows it really well because if you look at this model, you'll see 2 holes. This hole is the size of a hole you need to place in the bone for a conventional diameter implant. And this hole is the size of the hole that you place for a mini implant. And the procedure is so wonderful because there's almost no discomfort afterwards. They can come in, they can have their implant placed, and they can leave with a tooth in the same visit.
That's important to note. These are in-office procedures at your facility, and we should mention the Aesthetic Associates Center is where Dr. Todd is at. They are the leader in cosmetic and implant dentistry. They're at 2500 Kensington Avenue in Amherst. The phone number is 716-839-1700, and you have a patent.
Actually, John, I have 3 patents at this point in time, but in 2003, I applied for and received my first patent for the single tooth and multiple tooth replacement in one visit, where a patient could come in, they could have the implant placed and a permanent crown in just one visit, or multiple crowns in just one visit. And that's a tremendous advantage over the other system that can take months to years to complete. In the past, people used all kinds of glue and denture creams and denture paste to hold their dentures in. Now we use these little mini implants, and we usually put 4 to 6 of them in, and the denture then snaps right in and it stays very secure. This procedure came out in 1999, and this is what they were originally designed for. And it's done in one visit, usually in less than an hour. What I came up with was the idea of using these same implants for other purposes, such as single teeth replacement, multiple teeth replacement, and even a full arch of teeth replacement, which we'll talk about a little bit.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't smile, I couldn't enjoy the foods that I liked as much as I wanted to, and I needed to have something done.
You can't eat with them, you can't eat without them.
I didn't want to smile.
Whereas the mini implants, I can do anything within hours of having the procedure.
The best part about it is I don't feel anything about it. I don't have to think about it. I don't have to consider it at all.
The mini implants are the only way to go.
I just want to say thank you.
Now, I don't know about you, but everybody in Buffalo, we love our food. We love our beef on weck, we love our chicken wings. It's all there, but with the upper mini dental implant, that sense of taste is now going to come back again.
It's returned again. So after doing the mini implants for the lower denture for about a year and a half, I started using these same mini implants to stabilize the upper denture. And what we did is we started cutting off the roof of the mouth on the denture, the plastic, so that instead of having a full coverage over the palate, they now have this horseshoe design where you can taste the hot and cold foods on the roof of the mouth, And they'll also be able to eat corn on the cob, which they couldn't eat with their old dentures because the dentures would move.
You mentioned earlier how your technique now can afford someone an incredible look as if they have a brand new set of teeth. Show us why.
Right, so those patients who just want to eliminate the dentures completely, and there's a lot of them out there. Some people just want to get rid of the idea of having to remove their teeth completely. And we can convert you from a removable denture to a permanent set of teeth. We have two options for you to do that. One is what we call our Fix on 12 procedure, where we put 10 to 12 implants in and we cement the teeth in like your own teeth again.
That's almost as if you're giving somebody their third set of teeth.
Yeah, you know, God created us with our baby set, and then he gave us our second set of teeth. But if we don't take care of those teeth, we may not have them very long. So then we have to replace them with a third set of teeth. And that's what mini implants can do. We can put these 10 to 12 implants in and then cement the permanent teeth right on top of them so that they're very secure. They feel like having your own teeth again. You can eat and enjoy any foods you really want to enjoy and not worry about having to take your teeth out anymore.
Let's talk about the other example that you have in front of you.
This is a procedure I developed which is called the Fix on 6 procedure, where we do a similar type of restoration to that Fixed on 12, but this one is detachable. What I mean by that, it's detachable in the dental office. A patient doesn't take this out, but the dentist can take it out when they come in for their cleanings and checkups. So this one snaps on also. It's very, very tight. It's still made of the same porcelain material. It's very strong and durable. Once it's placed in, it stays in all the time. Otherwise, it's very, very similar to the cemented option. But this is an option for patients and dentists who want to have something that's retrievable.
I had the Fixed on 6 done. It was awesome. I can eat anything now. I can smile, I laugh. I don't have to cover my face anymore. It literally changed my life. Now I come to Dr. Shatkin all the time.
So I'm Princess Glitterhead. I didn't start having problems really until I was pregnant. That's when I lost my first 2 teeth. Pregnancy does cause a lot of women to have loosened teeth. So I made a free consultation appointment. I want to feel better. Like, what could I do? Like, I could actually go all the way and actually like fix myself, like for real, like actually be healthy, get rid of all the decay. I'm gonna go do it. I'm gonna go get my teeth back. He will do everything in your mouth like in a day and you're done. And you don't have to keep going back to the dentist. And I can see it helping so many people, including myself. It's gonna change your life, it really does. You have to do it.
Tell us why the Shatkin mini dental implant is so affordable and it is so different than other mini dental implants.
The Shatkin First mini implant that we developed and we sell around the country to dentists and around the world actually is a fantastic procedure because the mini implant is so minimally invasive that it's coated with a product called Ocean. What it means is the implant integrates with the bone very rapidly. In a matter of 2 to 3 weeks, you get full healing of the bone around the implant, and that's a very unique product that we have.
When we talk about the mini dental implant, and we've talked about dentures and full sets of teeth, sometimes people may look at this and say, well, that's for someone who maybe is a little bit older or who has some significant dental issues. But if you have some teeth that are on the back, and I know in my own mind, if something's in the back of your mouth, it's out of sight, it's out of mind. But those teeth are very important for the chewing process.
They sure are.
And the mini dental implant can help, and a single tooth.
Yeah, we had a patient who played football with my son in college, and he got his front tooth knocked out, and we replaced that tooth with a mini implant right in the front. So here's an example of the mini implant replacing a front tooth, a single front tooth where we put the implant in and then we cement the crown right on top of it. And we do this quite a bit. This is part of my patented procedure, John, that I developed back in 2003 and that we teach our dentists to do, where you can place the implant and a permanent crown in one visit using the Shatkin First implant along with our surgical guide and our stent. We also do that for multiple teeth. So here's an example of 3 teeth missing. We typically put in 2 mini implants for a molar, so the molar would have 2 and the other teeth would have 1, and then that bridge gets cemented on top of it just like that. And it's a permanent solution. In fact, I believe so strongly in the mini implants, I had a tooth that I had to have taken out. It's a long story, but just about a year and a half ago, I had to have that tooth pulled, and I had the mini implants put in a permanent crown, and it's perfect. I eat everything I want. I don't even know what's there. So when I had the choice of what kind of implant I would put in my own mouth, I chose the mini implants.
Of course.
So I will treat you the same way I'll treat my own family with mini implants.
And we'll hear from some of these people now that have had a single and a side tooth option.
I couldn't eat even on my right side.
There were so many things I couldn't eat because I couldn't bite on the front.
It was sore, it hurt, I couldn't chew.
My self-confidence was very low.
I was constantly having my hand over my mouth.
I would cover my mouth.
I had went to other places and it was kind of expensive for me. Dr. Shatkin made it financially able for me to get them done.
I have many dental implants with a bridge.
I had many implants.
There was no discomfort during the procedure.
I didn't feel any pain.
I just feel so much more self-confident.
But this just worked out great.
Get your smile back and be able to eat and feel yourself again is so rewarding.
It was one of the best things ever.
I'd recommend it to anyone.
It just changed my life, you know, it made me feel more confident.
It just changes your life.
It makes a big difference. Yeah, it does.
And Dr. Todd, we should mention that all of this is happening at the Aesthetic Associates Center on your campus. The teeth that you're talking about, these are made right here in Western New York with hometown people.
That's right. It's very exciting, actually, John. We have about 50 employees who work with me chairside, assisting me, running my office, and also running the dental lab and the implant company across the street at Shatkin First. All of these crowns, dentures, bridges, implants, and all the related products are all right here from Western New York.
And you know, we've talked about this with some other dentists. This is not something that just pops out of a box. These teeth are custom made for the patient.
Absolutely. So when a patient comes in, we take impressions, we take x-rays. Everything we do is digitized into a three-dimensional computer model. So when we make the crowns, it comes out of a milled block of porcelain. It's all designed beforehand, and then it's sent to a printer, essentially, that mills this from a block of porcelain into a beautiful tooth. And we design the teeth and the restoration, customizing the color, the shape, the contours of the teeth, so that it works in the patient's mouth.
Well, you can't do this alone. I know you have other talented dentists who work alongside you. One of them is Dr. Thomas Spilecki. He joined your practice several years ago and has been a tremendous addition. I understand he's an excellent clinician and performs all aspects of general dentistry, cosmetic dentistry, and implant dentistry. He's a Western New York native and also a longtime family friend of yours. Let's meet Dr. Thomas Spilecki.
So I've been here for about 4 years now, and I started assisting actually before working as a dentist. So I've been here in every capacity, as an assistant, as a resident, and now as a dentist. I've been practicing for over 3 years, and it's been fantastic. So I grew up in Buffalo. I grew up in Western New York. I went to high school at Canisius High School in the city, and I made my way to Geneseo for undergrad, and eventually NYU for dental school. And I always knew I would be back, so I've been back for about 4 or 5 years now. I think the biggest thing about dentistry that sets it apart from other professions, especially medical professions, is you can meet a patient in one day and learn about their story and see what's going on with their mouth and diagnose the problem and really fix it right away, as opposed to telling somebody what's wrong and sending them out the door. You can meet them and learn about who they are and really help them and get them out of pain really in a day sometimes. I do a little bit of everything, just like the other associates here. A lot of people will come here because they've been told implants are not an option. So a lot of the focus is on mini dental implants when there is no other option. But we do everything here: crowns, veneers, fillings. We see a lot of children, we see a lot of older folks, we see everybody, and we're happy to help in any way we can. So I think a lot of times patients come in and they may have seen us on TV or heard us on the radio, and they don't know if they're in the right place or they don't know if we can help them. And a lot of times just speaking to them and letting them know that there is an option goes a long way. A lot of people have been told there's nothing that can be done. And we're able to fix that problem, whether it's with permanent teeth or with dentures with implants. Sometimes we are the hope that people need. So it's been really great for me with the type of work that we do, transforming someone's smile, giving them the ability to eat, to chew, and the confidence when they go out. So it's really an incredible place to work, and I am appreciative of what I'm able to deliver to the patients where I might not be able to otherwise. So every case, every treatment plan is a bit of a journey from start to finish, whether they come in with no teeth or broken teeth, and eventually we get to the end and we deliver that final bridge or denture, and it is a sense of accomplishment and satisfaction that we have able to deliver that to someone. So it really makes it worthwhile to me to be in Buffalo and to deliver that treatment and to help people that I'm around every day. It makes me realize that I made the right choice, and it makes me feel accomplished and satisfied with what we do here. Working with Dr. Shatkin is incredible. Working with someone that is the foremost expert in what I do every day is an incredible security blanket. It gives me confidence, and every day I'm learning something new. So no matter how many times I've done something, or how many times Dr. Shatkin has done something, there's always something more to learn, and there's always some way to get better. And what better place to be than with Dr. Shatkin here. Aesthetic Associates Center offers a lot of treatment, whether it's the dental side or the plastic surgery side, but as an organization, you know, we have a family of people that can offer a lot, and at the very least, I think it's worth anyone's time to come in and meet the staff here and see what we can do for you. Where there may not be another option, the mini implant can provide you with permanent teeth or a denture with implants. A lot of times the cost is another issue, and we have, you know, many different options to get you started, and whether that's financing with 0% interest, or even the cost itself is oftentimes half or less than what it might cost with the traditional system. It's worth the time to come in and chat with us and see what we have to offer. If I had one single message to give to anyone watching this, I would tell you to come in and meet with us. You know, give us the opportunity to provide you something that maybe you were told you couldn't have. You could come to us, have a conversation for an hour, and at the end of the day, get as much information as you can. You may come in and say, I don't think I'm a candidate for this, but give us your time and allow us to show you what we can do. With the mini dental implant system, there's a good chance that we can give you the smile that you've been looking for, you know, the chewing, the functioning, and the confidence that you've been missing. So come in and give us a chance, and we'll give you the smile that you've been waiting for.
And the newest member of your team is someone you're very proud of. He too is a fantastic dentist and performs all aspects of general, cosmetic, and implant dentistry. Of course, I'm speaking of your son, Dr. Jared Shatkin.
So the driving force for me to become a dentist was really just seeing the way my father was able to take care of patients while he was coming up, and being able to shadow him on a daily basis, and just being able to realize that this is what I want to do to be able to provide for my family. Mini dental implants are definitely a big factor in why the residency I went to was the one at this office in Amherst, New York. It's really great for the patients because it's less invasive, it's a better price, and also you're able to snap in your dentures and people are able to eat a full meal again. My residency program, I placed over 400 mini implants, and what I was able to see is the changes you can make in such a short period of time in somebody's life. Have somebody in the chair crying because they finally have a full set of teeth. And I think the only way to do it in that type of time period for that type of price is really the mini implant. I just think Buffalo is really the city of good neighbors, and you come back and it kind of feels like home, and I'm happy every day to take care of the people that I kind of grew up with. And you almost feel like you know everybody in this city. And a big reason I came back was just because of that type of bonding I had with the city of Buffalo. I love to ski, I love the snow. Winter is actually my favorite, and just being able to withstand the winters in the past, it feels like it's like a badge of honor to come back here and being able to kind of share my experience with other people. Like, I'll have people come visit here during the winter to go to a Bills game or something, and they're like, how do you live here? I'm like, how do you not? There's such a difference in the community here as anywhere else in the world. I mean, I just love that it's not even just this, it's a community that revolves around the sports teams, but the sports teams also are involved in the community. It feels like you're one with the people here, with the professional athletes. They don't seem like they're too big for you. If you see them out at a restaurant, they'll say hi. They'll be happy to see you. And you know, now that our teams are starting to become successful, it almost feels like I put almost working with these teams as a fan, and to be back in Buffalo for when we're finally starting to become great, and for me to start to begin my career here with my father, it's a dream come true. So I'm very excited to be able to shadow him and to be able to take care of his patients when he's done, and kind of to continue this legacy that we have going on. I don't know if I would have been the type of person I was if I didn't have the type of journey I had, and I think it's something that maybe hopefully it can help other people in the future. But it definitely is something that I'm grateful for more than upset with. I don't think if I had a smooth time getting through school, I'd be the same dentist with the same compassion I have today.
We should mention, everybody, that Dr. Shatkin and the Aesthetic Associates Center is the recipient of a 5-star Diamond Award, and that's not only for dental expertise, but for customer service, and let's find out why.
Dr. Shatkin has created a great culture in his office.
It's always a great experience.
I was blown away by the service.
The staff is great.
His staff was very friendly.
It feels comfortable.
He was very informative.
I've recommended them a lot to a lot of my closest friends and family members.
I would recommend them to anybody.
10 out of 10. All the way.
Your Aesthetic Associates Center is growing. You know, where you are, 2500 Kensington Avenue, many people have gone there, and they've experienced life-changing procedures, not only with you, but with your dad and your brother. And the Aesthetic Associates Center has a long history, and it's growing. Tell us.
Yeah, John, it's been just a privilege and an honor for me to work side by side with my dad for the first 20 years of our practice. You know, he passed away in 2010. And then working with my brother for over 30 years now, both of them being board-certified plastic surgeons, and the fact that my father was also a dentist before he went to medical school to become a plastic surgeon. So it's just been just a wonderful ride, and I'm just thrilled to be here practicing and loving what I do every day. I tell the dentists that train with me that I wake up every morning about 6:30 in the morning, and I cannot wait to get to work because I love doing what I do. And not everybody can say that about their respective professions.
Well, you have a great passion for it. You work early in the morning till late at night. And these dentists that are coming in from across the country are now coming into your building. And I was there for the grand opening when you expanded. And you have a whole setup now that people can come in and learn so much. Tell us about how the building has expanded.
Yeah, well, this past year we opened our new building. It's an additional 15,000 square feet over our previous buildings that we have. So we have about 45,000 square feet of office space that we're fully utilizing in-house by all of us. And we're doing a lot of stuff there. It's really exciting. We can train 140 doctors at a time now in our main conference room. We can also train an additional 100 doctors in our subsidiary conference rooms that we have. My brother uses that space to teach Botox and fillers to medical professionals around the country. So it's really very exciting.
I think it's wonderful. Learned a lot. I do every time I come.
I love doing minis, and every time I come to the course, there's new techniques, new materials, new procedures, and I always come back invigorated and excited about what to expect in the future.
It's like a big family. They're always here to help you, and you can't do anything better than Shatkin first.
The camaraderie here is second to none.
Just see the new facility. My goodness, this is an amazing facility that he's built.
Every time I come here, I learn something more.
There's a lot of good information, and I learn something every time I come as well.
The hospitality is fantastic.
Wide variety of topics were covered, a lot of good cases.
I learn an immense amount, and I take it to my practice every day, and it helps me.
I just want to say that it's such a pleasure to have Ed come all the way from UK to so many of our courses. It's an honor and a privilege to have him here. He's a great dentist, and we love working with you over there. And thank you for being a loyal customer of Shatkin First.
Well, thank you very much. It's been a great course as normal, and I've learned a whole ton of new things. And every time I come over, there's something new.
It's been great. It's been a great experience.
Everybody here, top on down, is a first-class operation. Always.
And you have a residency. Explain how this works with what you've established.
Well, John, I think it was about 10 or 15 years ago, New York State changed their requirements to make sure a graduate dentist from any dental school in the country that wants to practice in New York State has to go through a one-year residency program. And what that means is they have to spend a year being mentored by other dentists in either a hospital setting, a university setting, or in our case, a private practice setting. We're very fortunate and very honored actually to be the only residency program in Western New York in a private practice setting.
And this affords the patient less cost with some of the opportunities that they would have for their dental work.
That's right. It's kind of like a university pricing structure. So the students who are dentists, they're full-fledged dentists, they graduate from dental school.
And I understand that they will be performing the dental work on all the patients with the supervision of yourself, Dr. Spulecki, and Dr. Jared Shatkin.
That's right. And because they're still in training, we offer about a 30% lower fee structure to them over what they would pay in our regular practice. Our Shatkin Dental Health program accepts most dental insurances, and we also offer financing options to spread your payments out over time. Then I want to emphasize, it's kind of like having two offices in the same location. We have my own private practice, which I've been in 30 years, and then we have the Shatkin Dental Health Practice, which is a new practice, which is the same quality dentistry, just at a lower cost for patients that are okay being treated by younger dentists, but the quality of the work will be phenomenal, and you'll get a little better price like you would at the university.
And your mind never stops, Dr. Todd, because now the Eye Smile Spa is out there for people who, like me, want to smile and look good.
Absolutely, John. We're pretty excited about Eye Smile Spas. It's our new Smile Spa right at the Aesthetic Associates Center in the new facility. And what it is, it's a new concept that I brought to Western New York where patients can get their teeth whitened and brightened. You know, we had Thurman Thomas and his wife in there recently and their daughter. We had a lot of the current Buffalo Bills and Buffalo Sabres players coming there. It's really spreading. It's very exciting. What we do is we whiten and brighten your teeth, and then we have a program where you can join the Eye Smile Club, where you can get unlimited whitening during the course of the year for $39 a month. It's a monthly subscription. So once you get the initial treatment done, you can come in for a whitening, and then you can join the Eye Smile Spa Club and come in as often as you want to have your teeth whitened during the course of the year. I want people to be able to have whiter teeth all year round. They can come in and get a touch-up whitening treatment done. And we also send you home with a whitening kit as well.
I am so happy with my experience that I had at Eye Smile Spas today. Got my teeth professionally whitened. I have months of results in less than an hour. No pain, seriously not even a sting. They're not sensitive. You leave with a kit to continue your whitening. Absolutely incredible. I'm so happy I ever did this. I can't stop smiling.
Western New York. Smile again with confidence. Call 43-SMILE today.
We checked out the website. You have so much to offer. The mini dental implant, the Shatkin mini dental implant. You're changing people's lives. You take care of it with a water pick and a visit to the dentist.
Yes, we recommend an electric toothbrush, a water pick, and coming to the dentist regularly to maintain their teeth.
And you have a patient named Ashley, I know, very special to you.
Yeah, Ashley's a wonderful gal. She's just a very lively young lady who had a bunch of missing teeth. And she came in and we ended up doing mini implants on half of her mouth with permanent bridge work, and it's really changed the way she feels and changed the way she looks at herself.
I was in a car accident. My front tooth cracked. I'm definitely embarrassed to smile. I got mini dental implants. It changed my life because it made me feel like me. Like I can smile and feel like Ashley. I just want to say thank you.
So you've changed her life and so many others.
I think we have, and we enjoy it. And like I said earlier, I love what I do. I can't wait to wake up in the morning and go to work because I love changing people's lives and helping them look their best. Because at any age, we want to look our best. Whether we're young, middle age, or older, it doesn't matter. You want to look your best, you want to feel your best, and of course, you want to enjoy what you're eating, enjoy the foods, and not worry about not being able to chew them or swallow them. If you feel good and you want to continue to feel good every day, you want to have a full complement of your teeth.
And you can do that at the Aesthetic Associates Center, the leaders in cosmetic and implant dentistry with the Shatkin mini dental implant at 2500 Kensington Avenue in Amherst, 716-839-1700. You make the call, you set up a free consultation. Dr. Todd and his team will talk to you. Dr. Todd, so much that we've covered here. You are an innovator in health here in Western New York. We are, as a community, blessed to have you and your team here.
Well, thank you so much, John, and it's a pleasure to be here, and I look forward to joining you again next time.
Thank you very much, and thanks for watching Innovations in Health.
Comfortable and quality dental care. Affordable prices, always fair. 839-1700 to call. 'Cause happiness starts with a smile.